checking in with you throughout the morning.
All right, Stivers Ford Lincoln over in Waukee, downright proud to salute great organizations in town. And today, a great organization that's going to give you a very important reminder.
Yeah, if you have kids going back to school, pay attention, parents, because we have an important message to let you know about. We're brought in someone from the Polk County Health Department. This is Nola Eigner, who is a health educator, and that's what we're doing this morning, educating the public. And
yes,
I feel like this is something people have been hearing about. I've seen billboards on it, but the deadline is right around the corner.
Can you believe back to school is in less than 3 weeks?
3 weeks?
Yes.
Less than 3 weeks, the kids are going back to school.
Less than 3 weeks.
Yes.
We think about that when the Iowa State Fair is coming around. But what is the important message we're getting out there today?
So the important message is the 2016 state legislation made a new immunization requirement, and they made that all 7th and 12th graders need at least proof of at least one dose of the meningitis vaccine before they go to school this year. They need proof of that, or they are not allowed in school on the first day.
Will they not let them in the doors?
Yes, so they need to show proof. So they need to show an immunization certificate and showing that, yes, I did get my immunization on the first day of school.
Now, all the years that we've talked about going back to school, I don't ever remember this being as important as it seems this year.
Yes, this is a brand new immunization requirement that the state of Iowa has put into effect. So we know that, it's interesting, we know that teens and adolescents are at the highest rate of meningitis in the United States. So it's absolutely important that they get this vaccine before they go back to school.
So who is this affecting?
So meningitis affects, this vaccine requirement is affecting 7th and 12th graders.
7th and 12th
graders,
okay.
Yes. So what happens is they need proof of at least one dose before they come into school. So if they're entering or transferring into 7th or 12th grade, they need proof of at least one dose of this vaccine.
So I was saying, so this is something that you'd have to request from your doctor to see whether or not you have received it already?
So what you can do is you can call your healthcare provider and they can look up your immunization records. And 11 and 12-year-olds and 16-year-olds should have had the vaccine as a part of their schedule. And so if they can look and see if they have had that vaccine. If they have not, they need to call their healthcare provider immediately to get an appointment for the vaccine.
How are we tracking this? I know it's one thing to say, oh, you got to get done or you can't go to school, but it's another thing to actually implement that so people realize how serious this is.
So we have worked, the Polk County Health Department has worked with all of the schools in Polk County, really working to educate families, nurses, to know the importance of getting this vaccine. And so what we have done is we have talked to the school nurses, and we know that in June there was 4,506 students who still needed that vaccine. We know from our state immunization database in July there was a little under 1,100 students that got the vaccine. So we're looking at about 3,000 students have not gotten the vaccine yet. But we do not know if they haven't turned their immunization certification in yet, or if they still have an appointment on the books that they need to get in and get the vaccine.
Now, is there any waiting period between getting the immunization and going to school?
Nope.
Say if someone said, I'm going to get it the day before I come to school, is that okay?
Yes, as long as you have that certificate that says you got the meningitis vaccine, then you're good, and you bring it into the school nurse.
Oh, wow. Okay. So we're talking big numbers here. Let's say people say, I don't have a regular practitioner that I communicate with.
Right.
Are there still places that are willing to help to make sure all the kids do get this vaccination?
So we want to make sure that if you have health insurance and you have a normal doctors, you call them. But if you do not have health insurance, you can call the Polk County Health Department.
Okay.
And we have an awesome program called the Vaccines for Children program. And this is for children who do not have health insurance. Their insurance doesn't cover the vaccine, or they might not have the financial means, and we can take care of that vaccine at free of cost.
There you go. So there really is no reason not to get this.
Absolutely.
Actually, you have to get it.
Have you heard any of the religious feedback of people saying they can't do it because of that?
So we always know that there are reasons that sometimes people don't want to get vaccines, and there might be a medical exemption. So a medical exemption might be that you have a health condition such as cancer or immunocompromised disease that allows you not to get the vaccine. Or some people have religious exemptions where they feel that the vaccine goes against their religious beliefs.
So do they call the Polk County Health Department, or how do they get around talking about that?
So if they have a medical exemption, they'll talk to their healthcare provider, and their healthcare provider.
And will they get a document from the healthcare provider?
Yep.
Okay, so that covers that aspect of
and
it.
A religious exemption they have to have it signed. So they have to get someone to authorize it. Okay. And this would be.
And who would authorize that?
You would have to get a notary that would sign it.
Okay.
Yep.
Interesting, because I
Yes.
know those do pop
Yep,
up.
they do pop up.
With unique individual
Yes.
circumstances. But the important thing is we're talking, according to your records, 3,000 some students are still needing to get this vaccination
Absolutely.
or prove that they
Yep,
have this vaccination.
absolutely.
And kind of talk about meningitis. You know, if people aren't familiar, they hear
Absolutely.
that they need a
Yes.
vaccination, but they don't understand why it's important. Can you talk about that a
Yeah,
little
so
bit?
what meningitis is, it's a severe bacterial infection, and it affects the blood and the meninges. And the meninges are that thin covering that cover the brain and the spinal cord.
Okay.
And we know that teens are at the highest, preteens and teens are at the highest risk of getting meningitis in the United States. And this is because, think about what teens do, okay? This disease is spread through close personal contact, through respiratory and throat secretion, so coughing and spitting. So think about this, they're sharing water bottles, they're sharing cups, chapstick, they're in dorms, they're in close contact with each other. That close extended contact is very likely that they can get meningitis. Now, even though this is a rare disease, the consequences are so severe. So if someone has appropriate medical condition, even if appropriate medical treatment, even if they have that treatment, 10 to 15% we see die from this disease.
Wow, that's how severe it is.
Yeah, and if the additional 20% we can see have permanent brain damage, hearing loss, or even an amputation. So even though this is a rare disease, this disease is incredibly, incredibly severe. It's
Nothing to mess around with.
potentially life-threatening. So if you
Yeah.
know there's an immunization for it, get the immunization.
done.
Absolutely.
And again, cost should not be an issue because
Nope.
you just covered that
Yes.
if cost is an issue, you have it taken care of.
Absolutely, and your insurance should cover it.
Okay.
And a lot of people I know, they're like, well, I have a healthy kid, I have nothing to worry about. Think of those that can't get the vaccination
Absolutely.
because they're dealing with cancer or other issues. They're not able to fight off
No.
other conditions like this, and especially one being so severe. So give everybody your information once again, because
Right.
if you have a kid going back to school, folks, you need to make sure they have their vaccination.
So we need to make sure that 7th and 12th graders, kids transferring or entering into 7th and 12th grade, get the meningitis vaccine. So if they have that meningitis vaccine, they still need to show proof. They need that immunization certificate on the first day of school, or they need to turn it early into the school nurse to show that they have proof that they've got the vaccine.
And if you don't have health insurance, Polk County Health
Yep.
Department willing to help out
Call
as well.
us and we're happy to make an appointment for you.
Fantastic. Thank you for spreading
Thank you
this very
guys so
important
much for
message
letting me
this
come in and
morning.
talk this morning.
Thank you. It is 8:22 right now, and we will be right back. This is CW Iowa Live in West Des Moines.